You're listening to the Sex and Psychology Podcast, the sex ed you never got at school and won't get anywhere else. I am your host, Dr. Justin Lehmiller. I am a social psychologist and research fellow at the Kinsey Institute and author of the book, Tell Me What You Want, The Science of Sexual Desire and How It Can Help You Improve Your Sex Life. For decades, menopause was considered a very taboo topic that almost no one talked about. And when they did, the only thing they said was that it can cause hot flashes. But for more than half of women, menopause brings sexual changes. This includes pain with sex, loss of lubrication, decreased desire, and sometimes a growing sense of distance in long-term relationships. At the same time, men in midlife have had access to highly effective medical treatments to support sexual performance for more than 25 years. So what happens when one partner's sexual function is medically optimized and the other partner's sexual pain is minimized, misunderstood, or ignored? That growing mismatch is what my guest calls the bedroom gap, the difference in sexual expectations and capabilities between men and women in midlife. And it's not just biological, it's cultural, it's medical, and it reflects a deep gender inequity in how we treat sexual health. I am joined today by Dr. Maria Sophocles, a board-certified OB-GYN and Menopause Society certified practitioner. She is the CMO of Ember Labs, a Boston-based wellness device company. Maria is also the author of the new book, The Bedroom Gap, which is all about sex at midlife. This is going to be a fascinating conversation that you won't want to miss. Stick around and we're going to jump in right after the break. Are you curious about sex and psychology in other countries? Join me and Sexual Health Alliance as we expand your knowledge through their study abroad programs. We'll explore different cultures, engage in immersive learning experiences, and collaborate with international experts while traveling to amazing places and having fun with students from all around the world. Since 2015, Sexual Health Alliance has remained at the forefront of sexuality education. Join me and Shaw and a global community of students for a transformative study abroad adventure. Our 2026 study abroad offerings include courses in Paris and Amsterdam. Check them out and learn more at sexualhealthalliance.com. Come meet fantastic people and be at the leading edge of sexual health education with Sexual Health Alliance. Spots for 2026 are available now. Visit sexualhealthalliance.com to secure yours today and embark on an exciting global adventure to study sex and psychology with me. Hi, Maria, and welcome to the show.
Hi, Justin. Great to be here today.
It's a pleasure to have you here. So you've just published a book titled The Bedroom Gap. To start us off, can you tell us a little bit about what this term bedroom gap actually means and why you felt like this was an important enough concept that it deserved a whole book?
Sure, and a whole term. I have been a board-certified OB/GYN for 31 years, and I would say the last 20 of them, my patients started getting older, so their problems started changing, and they started asking me a lot more problems related to menopause and specifically to the sexual fallout that accompanies the estrogen deficiency of menopause. They didn't put it like that. They would just come in and their shoulders would be hunched and they'd be looking down and they would say things like, there's something wrong with me, or I'm broken, or I don't want sex anymore. I don't care if I never have it again, but I feel really guilty because he really wants it. And they would say things to me like, men have needs, so I feel like I just have to keep up with what he wants, but I really don't want to. And versions of this story day in, day out. And I was aware, of course, as an OB/GYN, of the physiologic and anatomic changes that would happen in midlife. But I became aware that most women weren't aware of this and their partners weren't aware of this. And so I thought, okay, I need to tell the world about this, and did a TED Talk looking at what happens to sex in midlife physiologically and anatomically. If you go to my TED Talk, there's a little cute animation of what happens when we take estrogen away from the vagina. But it became increasingly obvious to me. And because you're all about sex and psychology, you get this better than anyone, Justin, that this was more than just, I need antibiotics, I have a broken arm, I need a cast, or I need vaginal estrogen to fix it and everything will be great. This was sociocultural. This was feelings of shame that my female patients were failing their partners. And by the way, this was for same-sex marriages and relationships as well, and in my trans patients as well. This was feelings that the bedroom, which was a metaphor for wherever their intimate life was taking place, that there was tension and discord and silence. So the definition of the bedroom gap is really the difference in expectations and abilities between partners. And it can happen at any time. I mean, there can be 25-year-olds who have different expectations or abilities sexually. But in midlife, it seems to widen because humans with penises get erectile dysfunction, humans with vaginas get vaginal dryness, libidos change for many people, hormone levels change, in some cases radically, some cases from surgery, some cases just from the natural aging of the ovaries. We know that testosterone in men drops anyway. So all of this was making this big gap in the bedroom. And I knew about the term orgasm gap, but to me, that was very finite. And this was a much bigger, broader concept reflecting history, patriarchy, the impact of pharma. What has pharma done for men and for women, and how has that differed? Biomedical research, how has that differed for the genders? It turns out it really has. And then what are the sociocultural messages that women get and that men get about who you are sexually and how you're supposed to be? And how does that impact how you or I walk into a bedroom at 30, 40, 50, 60, 70? So I wrapped all that up into a concept called the bedroom gap, and then it needed its own little book, which thank goodness is out this year.
Thanks for sharing that. I appreciate the thorough explanation. And, as you just pointed out, menopause for women comes with a whole bunch of sexual issues. It can include things like loss of libido or pain with sex. And there can be relationship fallout from these things sometimes because they're often not on the same page with their partners. And yet, culturally, whenever menopause comes up, the conversation almost always gets reduced to hot flashes, So why do you think the sexual side of menopause is something that's so often left out of the conversation, and instead it just gets reduced to like this body temperature problem?
I think for at least two reasons. The first is that women don't have a place to go predictably to talk about sexual issues. 69% of women have never talked to a clinician of any sort about anything sexual. So that's 7 out of 10 right there. Or like, no, sexual issue, that's one place I can't go. So now they're left with a girlfriend or an aunt or a neighbor. And frankly, they might get the side eye. They might say, I don't have any of these issues. Or they might say, oh, mine is much worse. I have depression, anxiety, and then be shut down. They almost never talk to their partners about it, which sounds crazy, right? We are married or long-term relationships with people. We talk about our children, if we have children, our pets, our home mortgage, our political choices, constitutional crises, tax bills, everything you can think of. We lie in bed at night and in the morning and say, you know what else is on my mind? We're out of bird food, all this stuff. But we don't talk about sex. And that is just this big, odd, taboo elephant in the room. And I've always found that really crazy. But I have women who come to me and they say, Harold and I have been married for 35 years and we have sex once a week, missionary position Friday night. That's it. And we have never, ever actually talked about our sex life, which I find crazy because Americans are big improvers, right? I want biohacking. I want to be more fit. I want to be more smart. I want to be less gray. I want this. I want that. They'll spend money to fix everything. But when it comes to what happens between the sheets, they don't talk to the very person they're doing it with. So that's why I think so many women have this issue, but it doesn't come out in the context of menopause. They view it as some other thing. And they link menopause to hot flashes, maybe some moodiness, maybe their hair falling out, maybe wrinkles, but they dumb it all down to physical things. And they don't realize really that when you take estrogen away from the brain, it affects libido. And when you take it away from vagina, clitoris, vulva, bladder, it affects those tissues chronically and progressively. Unlike hot flashes, Justin, which may go away after a year or two,
Mhm.
the changes down below are chronic and progressive and sometimes never recover. So we have to, you and I have to get this message out and link this for people so they know those symptoms you mentioned are in fact related to menopause.
Yeah, we actually did some research at the Kinsey Institute last year where we surveyed people about their knowledge of menopause symptoms. And we found that, even among menopausal women, there wasn't a whole lot of knowledge about what the most common menopause symptoms are, because a lot of the things that are experienced at midlife and beyond are just interpreted as signs of aging. They're not necessarily connected to menopause itself. And so, a big part of this is just that we don't do much at all in the way of menopause education. And so we need to help people better understand it. And so to that end, I wanted to ask if you could talk to us a little bit about the science here for a moment. So, in order to understand why menopause has such profound sexual effects, we need to understand, well, what exactly is happening in the body. So can you kind of give us the crash course into the key biological changes that occur during menopause and then what that means for sexual health and function?
Absolutely. So, menopause, just quick and dirty, is the cessation of function of our ovaries. Our ovaries are they're a paired little set of organs about the size of an almond. I mean, really tiny. And yet they're incredibly powerful for the health and vitality of women. The steroid hormones that they make, primarily estradiol, which is estrogen, progesterone, and testosterone, they're very powerful. They work on everything from our brain function, word recall, memory processing, to development of atherosclerotic plaques on the coronary arteries. There are actually estrogen receptors on the coronary arteries, to the maintenance of strength of our bones, to the joints, to the synovial fluid in the joints that allows you and I to roll our shoulders smoothly or not twist an ankle or not have arthritis, to the function of our skin and our hair, to our hearing, to our development of dental caries, to the film overlying our eyes, keeping our eyes moist. I could go on for hours, but let's say that estrogen is critical to almost every single organ in the body. So our ovaries age more quickly than other organs. This is just an anthropological mystery, to be honest. And until a couple hundred years ago, women did not outlive their ovaries, so it didn't matter. Women passed away, and we didn't know the ovaries were aging more rapidly. There is an interesting biotech research being done on ovarian senescence and aging, trying to stop or pause that aging, which could have massive ramifications for women's health in terms of slowing the development of everything from heart disease to dementia to arthritis to menopause, but we're not there yet. So menopause is when the ovarian function really basically shuts off. And this has massive health implications. It means our rate of development of cardiovascular disease, which is slower than that of men until menopause, approaches and even exceeds it. It means the most massive loss of bone strength occurs, bone mineral density loss occurs in those first 5 years after those ovaries stop aging. So these are silent things that all you might notice is some hot flashes or skin looking more dry. You might notice that, but what you won't notice is what's happening inside. And these are massive changes. So that's the definition of what menopause is. And basically, women now spend a third of their lives after that. So we're living so much longer, but we're constantly after that behind the eight ball in terms of function of our bodies deteriorating.
Yeah, I think that biological understanding is so important because, as you say in your book and also in your TED Talk, a lot of women blame themselves when sexual changes start to show up in midlife that might be connected to these bigger changes that are happening during menopause. And they see it as a personal failure rather than a physiological transition. So, how does reframing these changes from a personal failing to a biological reality, how does that help to reduce shame and self-blame? And, being able to reframe this and understand it, how can that help to improve women's sexual well-being?
Yeah, well, it can help you understand that, first of all, this isn't you being prudish, you being lazy, you being a bad partner. I mean, those are all things you just have to unhook. You have to unhook the ownership of that. That doesn't mean you can't work towards solution. And I think you and I both share the commitment that the psychology and having positive psychology around yourself as a person, around your body, around sexuality as an important part of who you are is so good for your self-worth, for your relationship. It's even good for longevity and health. But the first thing listeners have to do is unhook themselves from some nebulous thing that's happened to them and it's inescapable. Yes, menopause happens to 100% of us, absolutely. But it can also be a rebirth or a renaissance, if you will. Think about it. You no longer need contraception, so you don't have to worry about, oh, am I going to get pregnant? You have access in the United States to inexpensive, safe treatment for the lack of estrogen in the urogenital system. Vaginal estrogen is generic, it's safe, it's been studied even in women with cancers. Fine, no problem. There is no one that it's really contraindicated for. So there's no reason you can't preventatively keep things healthy or rehabilitate genitals that are not healthy. We have still no FDA approved testosterone for women, but we do have compounded testosterone available from experts like myself who work with compounding pharmacies to be able to have women use that either systemically or topically. And we'll talk later, I think, about how you can use that. So I think it's about, and you can answer this as well as I can,
Mhm.
I know, reframing this chapter of life, not as the end and doom and gloom, and it's all downhill from there, but as a time to focus on yourself, perhaps for the first time in a long time. Women tend to be servers, nurturers, givers, pleasers. It may be a wonderful time to say, my kids are out of the house, they're launched. My parents are aging and I'm going to help them, but I'm going to carve time for myself, whether that's discovering masturbation because you've never done it before, or reinvesting time in yourself, getting to know your body, even erotic content, bringing that into the brain. Take away the shame. You're not a bad person if you watch an adult video or you read a book with steamy content that inspires erotic thoughts in your brain. It helps make you a better lover in many ways because it means you're thinking about this. So women have a lot of redoing of definitions. What it means to be a good woman has to be unhooked from some prudish, puritanical set of values that either we learned in Sunday school or the 50s. I'm not sure. Justin Kinsey probably has more in-depth answers than I do, but I think we have gendered masturbation, for example, in my opinion, that masturbation for humans with penises has been considered normal from cradle to grave. It's just assumed if a teenage boy goes in his room and locks the door, it's assumed what he's doing and he's got needs and he's normal. For a girl to do that, bang on that door, get her out of there. That's not right. Don't look at your body. Don't touch it. Don't say the word. It's a bad word. These are basic things I think little girls learn, and believe it or not, they carry with them their whole lives. I think we have to start very early, Justin, and reframe all this so that midlife women won't carry that burden.
Yeah, I think you raise a lot of really important points. I mean, obviously, yes, the issue of sex education and starting early, I think is really crucial. I think we also need sex ed is not just a one-time thing that we get when we're a kid because you can't tell everybody everything they're going to need to know about their body and their sex life in the span of one conversation. So we need some ongoing sex ed. When it comes to great sex, wetter is better. That's why I'm excited to introduce you to Soaking Wet from VB Health. It's the world's first probiotic specifically designed for vaginal and vulva health and wellness. Soaking Wet is a doctor-formulated blend of prebiotics, probiotics, and vitamins specifically designed to restore balance down there and increase lubrication. This isn't just about health, it's about pleasure. VB Health has a simple mission, creating supplements that actually work with scientifically backed ingredients. They take quality seriously too. Each batch that is produced is tested by 2 separate third-party laboratories for safety and effectiveness. They even share their third-party lab results publicly, which is rare. Make every encounter slipperier, sexier, and downright sensational. It's time to get soaking wet and keep those good times coming, literally. And the best part? Soaking Wet is formulated by doctors at VB Health, and it works. Visit soakingwet.com and use code Justin for 10% off, or click the link in the show notes. February is such a good reminder to slow down and ask, how am I actually taking care of myself right now? For me, a big part of that is creating little moments at home that just feel comforting. And that's why I've really come to love Cozy Earth. Their bamboo pajama set is one of those upgrades that you notice immediately. It's unbelievably soft, lightweight, and breathable, so you stay cozy without overeating. Slipping into them at night makes it easier for me to unwind and fall asleep. You also have to check out their classic cuddle blanket, which is perfect for long evenings on the couch when you just want to indulge in comfort. It's plush, has just the right amount of weight, and once you wrap yourself in it, maybe with your special someone too, you'll wonder where this blanket has been your whole life. What really sets Cozy Earth apart is their quality. These pieces are thoughtfully made, designed to last, and meant to elevate everyday moments. They offer hassle-free returns if you don't love your purchase, plus a 10-year warranty, because once you feel this kind of comfort, you'll want it to last a decade. So if you're looking to show yourself or someone you care about a little extra love this month, head to cozyearth.com and use my code Justin for up to 20% off. And if you get a post-purchase survey, be sure to mention that you heard about Cozy Earth right here. Celebrate everyday love with comfort that makes the little moments count. But I think when it comes to menopause too, you make a really important point that it isn't all doom and gloom, right? And that there are positive things that can come out of menopause. And I know, for example, in some of the research and data that we've collected, that some menopausal women say they're actually having the best sex of their lives and that their orgasms are better than they were before, or they're less elusive. And so there can be things to look forward to.
Definitely. They're freer, right?
Yeah.
They're freer. They don't have the pressure of a 25-year-old in hookup culture where the guy is orgasming in 3 minutes and then the girl feels some pressure, I think, to be like what she thinks he saw in porn and have an orgasm from penis and vagina sex in under 30 seconds. And I think that's almost a bigger pressure in the 20 to 30-year-old crowd than in the menopausal crowd. Would you concur with that?
I think so. Yeah, that makes sense to me. With regard to some of these negative things that can happen during menopause in terms of changes in sexual health and function, you did mention that, there are lots of things that you can do to address sexual pain and discomfort. But as you point out in your book, a lot of women are not using them. So I wanted to ask, why is that? What's stopping a lot of women from accessing or accepting treatments that could actually genuinely improve their sexual experiences during menopause?
Yeah, 2 main things. The first is doctors don't give them permission to speak. Doctors are like, your blood pressure's fine. I did your pap smear. I ordered the mammogram. Great to see you. Good luck. See you next year. And they're out the door. You get 15 minutes if you're lucky. You wait 9 months for the appointment. The doctor's burnt out. They're in a hurry. And remember, they're uncomfortable talking about sex because they were not trained in medical school and they might be bringing their own baggage from their own home life. Maybe they grew up in a home where you don't talk about sex. So when you combine all that, it's mostly a doctor visit is not going to foster that preemptively. And if the doctor doesn't preemptively say, Justin, I want to make sure your sex life is also happy and fulfilling, Are you having sex? How often? Are there any issues? I'm going to sit down here in a chair and use body language to show you I have time and attention for you. That happens almost never, right? Their hands on the door and they're walking out going, anything else? All right, bye. So the clinical visit's not going to do it for you. The second is the big fear of estrogen and cancer, which, believe it or not, we still can't unhook from many, many women. I've worked for years to help get the black box warning off of estrogen. And finally, this fall, we did that for vaginal estrogen. I think this will help. But that is a lingering fear for so many women. And they look at the box and they think about it and they say, I don't care what Dr. Sophocles said. My hairdresser told me she thinks her aunt's cancer happened when she was on estrogen, so it must be, and they don't take it. So until we really bury that link, which we know now it's just weak, I think we're going to get a lot of women not asking or taking the prescription home and not filling it. I think those two things.
Yeah, and I think that speaks to the fact that we need to do a lot more on the part of physicians to educate them about the science of menopause and treatment options that are available, and also make it easier for them to communicate with their patients about menopause and sexual health issues. But we also need to normalize for patients that it's okay to bring these things up and talk to your doctor about them. And I know that, for most people, when they go visit the doctor, sex doesn't come up. I'm one of the exceptions because every time I go for my annual appointment, it lasts 45 minutes and we talk about sex the whole time. But it's because my doctor is kind of like views me as his form of continuing education, right? Because we talk about the latest sex science that's going on. And so anyway, everybody's experience is a little bit different, but we need to normalize those discussions, conversations about sex in the doctor's office, because if we can't talk about sex with our doctors, like who could we talk about it with,
Right. And if your own doctor is uncomfortable, that's awkward too. But you have to also really believe that vaginal estrogen, which is a local compound, it basically does not go into the bloodstream almost at all. It cannot cause dementia. It cannot cause a breast cancer. The data is so clear from those of us who look at studies and look at the addition. When we combine many studies, we call that meta-analysis. And when we look at a meta-analysis of vaginal estrogen, we just do not see it as a danger. I think vaginal estrogen's done a terrible PR campaign for itself. Until it does better, we're not going to get enough women using it. And I think like every woman in the country over 50 should probably start using it. And by the way, you can use it right up until the end. You can use it at 85 or 95. And the longer you use it, the longer you're not getting not only painful sex, you're getting clitoral health and you're getting reduction in urinary tract infections, which can be quite a dangerous thing for older women. So it really has health benefits. Sorry, I sound like a saleswoman for it, but it's because I get to see the benefits of the women who use it chronically.
Yeah. And I think, it gets at the fact that there are lots of misconceptions about hormones and menopause and hormone replacement therapy and, the difference between vaginal estrogen versus taking systemic hormones, right? There are different hormone delivery mechanisms that doctors and their patients need to be aware of. And with the vaginal estrogen, the side effect profile, the risks of that are much, much lower compared to using systemic hormones. And so we need to have that better understanding, better education about these things, because there are so many myths and misconceptions about it.
Exactly. And I think that also, just to make it quick, in my TED Talk, if people look, there's a nice little animation of the difference between systemic and vaginal and how vaginal estrogen is so safe. Systemic is safe as well. It's just that in the uterus, it can cause growth of the tissue. So we want to be careful. If you have a uterus and you're taking systemic estrogen, you really want to make sure you have progesterone also. That's the big bugaboo. It's not that complex. And systemic estrogen itself has now been linked to reductions in many cancers, reduction in stroke, reduction in heart disease, and possibly benefits in brain development and dementia onset and things like that. I don't want to overpromise because some of this is, in fact, mixed results. So we still are waiting for some, but things like bone, boy, that's a no-brainer. Best thing you can do for your bones is probably have systemic estrogen from menopause on, plus move, of course, movement.
So we've talked about a lot of the things that contribute to the bedroom gap here, but one that I wanted to talk about is the issue of Viagra, right? Now, Viagra didn't cause the bedroom gap, but it has certainly widened it. And so I wondered if you could explain what you mean by that.
Yes. So Viagra, I'm never going to say anything negative about Viagra because in some ways it renovated sex for an entire generation of men who had ED. And now it's become almost a designer drug for men with or without ED, gay or straight. And it's available in a very widespread way. But unfortunately, it allowed the partners of the heterosexual men who got Viagra to sort of feel a little left out. In other words, if you and I are a couple, Justin, and you get Viagra and we were in our mid-50s, sort of aging together, maybe having a little less sex than we used to, but still having sex. And now you can have erections on demand. You may want to have sex 4 or 5 times a week, where I was sort of okay with the once a week, but especially with vaginal dryness, this is now hard to keep up with. I term this Viagravation, or just, the concept of a sort of disequilibrium between heterosexual couples. And it's actually those couples that first gave me the idea of the bedroom gap, because I felt that the Viagra widened that gap, whereas the women who are often not treated and not knowing what they were supposed to treat were now really sexually kind of aging out. And if you wanted to take it a hypothetical step further, you could say, well, if men are armed with Viagra and cohort, and they want more sex and they're not getting it at home, and the wife is turning away or turning on the late show, this could drive a wedge in a relationship and lead to infidelity even. I mean, I know that's hypothetical, but, they call it the gray divorce or whatever.
Mm-hmm.
And so, again, it's not fair to directly blame Viagra, but I think that it provided a renaissance, a sexual renaissance, and we didn't have one for women. And in some ways, we still don't, even though I'm all happy about vaginal estrogen. Remember, vaginal estrogen is not on-demand erections. It doesn't really make your libido go crazy or anything like that. And as you know, we have a couple of FDA-approved medications for low libido for women. We have flibanserin, brand name Addyi, FDA approved in 2018, and then in December 2025 for postmenopausal women, and Vyleesi, an injection, an on-demand injection, bremelanotide. But I would say neither one has had the mass commercial success that Viagra has had. They're either expensive and not covered, or have side effects, or the results in random placebo-controlled studies have been sort of middling, sort of sort of like, an orgasm when you're still thinking about your kids failing calculus grade. You're like, So I think some of that may be to the biomedical research gap, right? Maybe we need more time and money researching what women want and need sexually. But this is where we are now. I feel that if you look at the pharma offerings for men and women, they're pretty disparate. What do you think?
No, I totally agree that men have more options available to them and more accessible and affordable options when it comes to dealing with sexual difficulties. But, this is also where the issue of testosterone for women comes up, because increasingly that's being seen as another potential way to help close the bedroom gap. But that's what we're going to talk all about in the next episode. So thanks so much for sharing all of this information with us about the bedroom gap. I'm looking forward to continuing our conversation and talking all about testosterone and women. Can you please tell my listeners where they can go to learn more about you and your work and get a copy of your new book?
Sure. My website is mariasophoclesmd.com. So mariasophoclesmd.com. On Instagram, it's at Maria Sophocles MD. The book is called The Bedroom Gap. So whether it's Amazon or your local bookseller, everyone has it. And it's a lovely little book about what happens to sex for us with age and what we can do to really hold on to good sex for ourselves in midlife and beyond. Justin, thank you so much. It's been lovely for me, and I hope we'll get to talk again.
I hope so. And I'll be sure to include links to all of that in the show notes. Thank you again so much for your time. I really appreciate having you here.
My pleasure.
Thank you for listening. To keep up with new episodes of this podcast, visit my website, Sex and Psychology, at sexandpsychology.com, or subscribe on your favorite platform, where I hope you'll take a moment to rate and review the show. If you listen on Apple Podcasts, please consider becoming a Sex and Psychology premium subscriber to enjoy ad-free listening for just $3.99 a month. You can also follow me on social media for daily sex research updates. I'm on Blue Sky and X at Justin Lehmiller and Instagram at Justin J. Lehmiller. Also, be sure to check out my book, Tell Me What You Want. Thanks again for listening. Until next time.